Hello and welcome everyone to today's webinar, In-House Dialysis, Your Untapped Advantage, presented by Skilled Nursing News. This webinar is sponsored by Outset. And before we begin, let's review a few housekeeping items. You will find the main menu at the top of your screen containing all your attendee tools. All tools are resizable and movable to personalize your webinar experience. We welcome your questions and participation. Please use the Ask a Question tool to submit any questions you may have during the live webinar or as you watch the on-demand recording. We will do our best to address them during the Q&A portion at the end of this session or via email at a later time. You will also find a reactions tool that will allow you to submit real-time feedback using emojis. Additionally, the PowerPoint slides and additional resources are available for you to download within the Attendee Resources tool. And attendees will receive an emailed link to view the on-demand recording as soon as it becomes available. The recording will also be available on the Skilled Nursing News website. If you experience any technical difficulties, of course, during today's webinar, please close out any other opened browsers or applications and refresh your internet browser, and you can click Help in the top menu for more troubleshooting steps or reach out to us during the Ask Question tool. And without further ado, let me introduce our panelists. So our panelists during today's webinar include Molly Godley and Erin Lamontagne, both regional nurse managers for Carmen Kidney Health, and our panel host, Jennifer Prosperi, clinical sales representative with Outset Medical. Jennifer brings over a decade of diverse nursing experience to her role at Outset Medical with a clinical foundation spanning med-surg, home health, and hospice care. She plays a key role in supporting providers as they bring dialysis in-house with Tableau hemodialysis system and has served as a trusted mentor in the Outset field training program. And now I'll pass this off to you, Jennifer. Thank you. And I'll be back for the Q&A.
Thank you, Zahida. Really happy to be here today and talking to one of our really close partners, Carmen Health. Before we turn it over and start the conversation with them, we are going to kick things off with the poll question. So we want to get just kind of a read on the audience and get your thoughts. What is your biggest concern about adopting an in-house dialysis solution? And so we've got a few answer choices there. Feel free to select whichever one pertains mostly to you. We've got A, regulatory and CMS compliance, or is it more related to staffing and training concerns? Is it around the ROI financial model? Or maybe it's operational workflows. How is this gonna, affect different things we have going on within the facility? So we'll give you guys just a few more seconds to get your answers in there. And then we will see what everybody thinks. All right, so we'll flip it over to our next slide there. We see regulatory is a big one. No surprise, there's always tons and tons of questions around that. So we will go ahead and get started. I've got a pretty good idea that we'll hit a little bit on all of these topics today. So without further ado, we will welcome Erin and Molly with Carmen Health. Thank you both so much for being here today. It is not easy to get these two on the schedule, so we really appreciate you guys being here with us and really giving your experience and sharing your perspective on this topic. So Erin, I'll just start with you. Can you tell us a little bit about your journey? How long have you worked in healthcare, and what's your role in Carmen Health, and what really brought you there?
Thank you, Jenny. So my name is Erin Lamontagne. I am an RN, and I got my RN license in 2010. and I fell into dialysis in 2013. And I've been in dialysis since 2013, so about 12 years. I started out with an LDO and then a smaller sort of LDO, but my specialty is in home dialysis. And I was really drawn to Carmen because of our values. We really have patient well-being at the forefront of our minds, and it was an opportunity to really help change the face of dialysis and offer it to patients in a new way.
Nice. And Molly, how about you? Can you tell us a little bit about your background and what really drew you into this line of work?
Yes. Okay. So as you know, my name is Molly Godley. I have been a nurse since 2008. I started my journey as an LVN. In 2013, I became an RN. I have spent the majority of my career in an acute dialysis setting. I like to say that Carmen found me at a time where I was angry. I was upset with the healthcare industry, and I was desperately needing a change. So off of a friend's referral for a charge nurse position, I went in and interviewed. When I walked out of this small 5-chair clinic in the middle of Floresville with a census of 6, I said, I need to be a part of that. So there's the start of my chapter.
Nice, nice. Yeah, I always love to hear stories about people that, really have a personal connection and a passion for what they're doing. So for those out there who may not know Carmen Kidney Health, maybe they've never heard of you guys before, can you give us just kind of a quick snapshot of who you are, who do you serve, where are you located, and what is Carmen's role in supporting these skilled nursing facilities, or SNFs as we like to call them?
So we are not just a dialysis company, we are a kidney health company. We like to take care of patients with any stage of kidney disease or no kidney disease. Carmen came to be in the United States, actually in Texas in 2021, right in the middle of the pandemic, when our founder, who had was moving back to Texas after being gone almost a decade, building a very successful dialysis company, he came to find that in the US there were lots of needs, especially in the rural and the underserved areas. So we started building a boutique style clinic in rural and underserved areas. That's how we came to Floresville. We're in Floresville, we're in Bulverde, and we're in Lakeway. We have home and in-center programs in all of those clinics, in addition to chronic kidney disease testing, or screening, I should say, for anybody. And we can see where anybody stands with their kidneys. But we wanted to provide choice and convenience. And Carmen was really named after our founder. His name's Andres Gutierrez. His nanny, her name was Carmen, and she was always available anywhere, anytime. And that's sort of the standard for Carmen.
Nice. Yeah, I love to hear that story. I thought it was so interesting the first time that I heard you guys kind of tell me how Carmen was really born and created. And yeah, really interesting there. So Molly, you guys are, you serve in-center patients. You have started sending patients home on dialysis, which we love, of course. But what first got you thinking we should really bring in-house dialysis to these SNFs? Where did that idea come from? Was there certain challenges or a certain turning point that kind of pushed you in that direction?
The conversation actually started with our Bulverde clinics. We were a stone's throw away from one of our SNFs. And they came, they toured, they mentioned they had a den, and an immediate thought was, we should also be in that den. What a great idea to, serve this community that has difficulty transporting, has difficulty with maintaining their therapy regimens, has extra, and not to mention they have, they have the skilled nursing staff there alongside our staff in combination would be just a great formula for success. So I asked to go and tour it, and it looked great and ready to go. And I said, why don't we? And that was pretty much the gasoline that started it all.
And Erin, what was your reaction when Molly kind of started this ball rolling?
You know, these residents at these SNF locations, oftentimes they're there for rehabilitation, and it's hard to fit in all the hours of rehabilitation that they need to do when they're being carted back and forth to a dialysis facility, not to mention that they feel pretty wiped out after dialysis. So it really seemed like a great benefit to our patients, and it aligned with our values and our motto of choice and convenience. And it was something that I felt truly the patients really deserved, and that we could get online for them.
Yeah, absolutely. So now that you guys have made the shift and started implementing and bringing in-house with these SNFs, why would you recommend in-house dialysis to other SNFs? What do you think has made it worth it for the patients, the staff, and their organizations?
I know Molly has a very specific story about some ways that this has truly affected our patients' lives in a positive way. But as I mentioned, the rehabilitation portion, they really need to be able to have their rehab, and it really knocks them out to have to go back and forth to a dialysis facility. In addition, continuity of care. If you truly care about your patient's well-being and their quality of life and their quality of care, it really helps with continuity of care for the patients when we are in-house and we can talk to those nurses. They only have a short jaunt down the hall to come and visit and do their dialysis. And then in addition to that, and being beneficial for the patients, it's also beneficial for the SNF centers in reducing their transportation costs and things like that.
Yeah, I know there's a lot of challenges and, misfortunes that can go into that transportation piece. Certainly heard stories from other SNFs as well. Injuries and different things that can occur. It's just additional risk that, maybe is not necessary. But Molly, I know you've been really close to the patient experience. Is there any, story that you would like to share that really highlights why this change is important and the impact that it's had on, maybe the patient or the family?
Yeah. So when it comes to dialyzing in a SNF setting, the biggest, we're looking at infection, we're looking at hospitalization, we're looking at decreased transportation. These are things that these are all the, you Google anything, you YouTube anything, that's what it's going to say. But to truly be on the floor and see how these things work in conjunction is absolutely mind-blowing. We, just over the weekend, we had a patient who had a hemoglobin of a 6.8. What happened is that we received this information. We were able to get it over to the SNF and talk to them and state, hey, you know what? They have a 6.8. We need to go ahead and do something about this. They started working, sent out the patient to get a blood transfusion. We were also in communication with our floor staff so they know what's happening when they walk into their, to their unit, so that they know which patients are critical and start flagging on what they actually need to be doing for their start of day. So the part that really was truly transformative was the fact that the SNF nurse had forgotten to document. She had forgot to document that the patient received a blood transfusion, that he just went out, got the blood transfusion, and came back. So in any other facility, they would have sent 6.8, especially in centers. You'd send 6.8, you'd have been like, okay, you wouldn't have got the information until probably, I don't know, maybe they're on the treatment, or maybe they got there that, hey, there's a 6.8, can we dialyze them? No, we got to send them out. They miss their treatment, they get hospitalized, or doing all the tests under the sun, or they don't get, or they get the information. They said, hey, they're not coming to dialysis. We need to see what the physician needs to do. So we eliminated everything. The DON was on the phone trying to see what we can do about getting stat labs and getting all the information. Our people are on our side. We're communicating with the physician. We're all in conjunction. We're all on the same page. We're all communicating, all while the patient is comfortably sitting in their room. Nothing happening to the patient. The patient's watching TV, going to his dinners, going to his therapy, totally relaxed. They are not being affected. So, at 1 o'clock, mind you, it's a 7 o'clock chair time, 7 a.m. At 1 o'clock, the stat labs come in. He's safe to dialyze. We're able to bring him in for treatment. In an in-center, he would not have treated if he had to go up. He would have missed his dialysis or would have been hospitalized. And that, in just this weekend and all the communication that we had with one another, and this is one of many different scenarios, we were able to save a hospitalization, to make a patient comfortable where they didn't miss their treatment, they didn't miss their therapy, and we communicated beautifully with the staff, with the floor staff, with our staff, and with the nephrologist and the PCP. So that's just one example of many of how SNFs are better for the patient.
Wow. Yeah, that's really incredible. I mean, you think about an entire hospitalization that was saved, just that one example that you gave right there, that's really telling. So you gave a really good example of, one of the clinical benefits, kind of taking it at a different angle, from looking at it from a business perspective. What would you say has been the biggest impact? And have you noticed any changes in operations or staffing or the financials that really you've seen a difference in, or that's benefited the organization?
Well, staffing, people are a huge part of any operation. You have the right people in place, you have the right results. Without the right people in place, you will not have the right results. So it all starts, honestly, on the interview process. 51.9% we're talking about CMS regulations and QAPI. If you have the right people in place that have the patient's well-being at heart, then they will follow the regulations. They will be receptive to the whys. They will ask the questions. And if you have the right management in place, they will answer the questions and they will be receptive to the questions. So people make the world of difference in any way you look at it. Financials will come. I would refer everything to your financial department so that they can turn around and try to figure out, what works best for them and types of insurances. But the people, you start with the people and you have all these regulations and processes, and then you see the upflow go up. So that's what matters.
Yeah, absolutely. So kind of looking back at, the implementations that you guys have done so far, what would you say are the biggest factors that have made your program successful? What has worked well that you would like to share with others?
I jokingly and lovingly say that Molly is our key to success with our SNF, locations. She has a bias towards action, and she really digs in and figures out how to overcome any barriers to getting our DENs up and running and provided to these SNF locations. I think that one of the key aspects is having the right machines as well. And I know that by having the tableaus in there, that's been something that's been huge as far as space-wise for us to be able to provide this. Another key element has been partnering with Tableau. They've been really helpful in reaching out to SNF locations and also helping us understand and connect with other subject matter experts within SNF locations. And so we had a little help behind us with our research and getting in.
Mm-hmm.
Yeah, absolutely. That's why we really do, consider it a partnership and refer to you as a partner, not a a customer or a colleague. It really is a true partnership. So can you tell me how you first heard about Tableau? As you mentioned, our device. How did you hear about Tableau? How did you hear about Outset Medical?
I had previously worked with Outset in other jobs, but our fearless leader and founder, CEO, Andres Gutierrez, is very big into the latest technology, the best out there for the patient. And he really did a lot of research when it came to choosing the machines that we choose in each clinic to use. And so he had gone with the Tableau to begin with. He lovingly calls it the Tesla of dialysis machines. It's a smaller footprint. You don't have an RO next to a big dialysis machine, so you can put more machines in there. It's very versatile. It's easy to use. You can know nothing about a machine and set it up just by the different screens that it shows you. And it uses the acid and the bicarb in the jugs. So you don't have any science experiments, is what Andreas would call them, going on behind the scenes in a water room. It's very easy. It's very versatile. And Outset has been a great partner to us in helping us get in there, figure out any barriers that came up on us. And so the Tesla machine, the Tableau machine was honestly the best choice, not only size-wise, but versatility. And we've actually seen some benefits with patients' lab outcomes using the slower, more gentle machine.
Nice. That's good to hear. I know I've heard that feedback before, which is especially helpful with the rehab part of many of these patients, what they're doing in these facilities. Molly, is there anything about the Outset partnership that you feel has benefited to the success of your SNF program that you guys are building?
Yes, we're trying to build a segue from the SNF to home. So as good, we have amazing clinicians out there working hard in the hospitals, working hard in center, but to be honest, we don't have time sometimes. And it's hard to reach every single patient. So we're trying to do our part to educate them on the home program. So we want to introduce them to something that's easy to use. So the machine that they are being dialyzed on in the SNF, they will be utilizing at their home. So they go into an in-center, they go into a hospital, big bad machines are everywhere, beeping, it's scary, they're confused. They come to us and they see this, to say the least, this little Smurf sitting there. And it's compact, it's easy to use, and it's a little less scary for them. That's why I love the Tableau machine. It's not something that's someone wants to run away from. It sings to you. It makes things very soothing. It's fail safe. The emergency rinse back is super easy. When I was learning dialysis, my preceptor says you won't know anything until 5 years in, Molly. So just get used to not knowing anything. Well, with the Tableau, I can't say that. So it's very user friendly.
Yeah, that's great to hear, especially when it comes to, making your staff comfortable as well and having that confidence. Really the focus should be the patient, not the machine, right?
Mm-hmm. That Tableau University is absolutely amazing. We actually use that with CMS to show that we have trained on the Tableau because they do provide a certificate. So that really helps with saying, yes, they are fully trained on this machine and can utilize it.
Nice. That's good to hear. So if you had another SNF leader, administrator approach you about starting a program, what is the first piece of advice that you would give to them? Any recommendations or specific advice you'd share?
A huge pearl of wisdom. Don't blur the lines. It's an at-home SNF program. It is not an in-center program. It becomes very easy to take your in-center and your SNF and start saying, oh my God, we need to do all these regulations. And when you get into that mindset, walk away for a little bit. Tell yourself, you know what are we really doing? What is this program truly about? And then go back to the proper regulations. You follow the regulations. CMS, the state of Texas, well, any state wants to know that you're conducting safe dialysis. So you follow those rules, you'll be fine. Don't blur the lines.
Yeah. And so for some of our listeners who may not, maybe they haven't looked into doing this, maybe they have some confusion as far as, those regulations, CMS requirements. Can you kind of explain, just a brief explanation? You guys are actually going in and providing the service. These are considered home patients, but they're your patients as well as the SNF. Do those, a lot of those regulations fall under your license? I know if you have like a dialysis patient in a SNF, they go, transport out to their clinic. Typically, they're still responsible for, anything that happens, if I understand correctly, while they're gone. How does that differentiate? How does that work when you guys come in and provide the service in-house?
It's a home. It's a home dialysis. So we are a guest inside of their home. And that's how you have to think about it. They're not coming to our facility for dialysis. We are a guest. So everything, even down to how we do our codes and our code system, there is no, inside of a skilled nursing facility, there is no intercom system because it's their home. So we had to find a way to, how are we going to alert people that we have a code? We use the word code. They use the word, it's not a rapid response. Definitely do not use rapid response. Just that they need extra help. But there's different verbiage for a SNF. So that was something that we had to get used to. Also, the fact that they are in a home program, they state that there has to be one machine to every patient. So there was a fleet of machines at one point when I walked in to see a different provider. And I was just like, okay, that's not sustainable. How are you supposed to do that? So I looked in the Tableau regs and how we're supposed to disinfect. That you can use one machine for another patient, but there has to be a disinfection period in between it. So that's a good example of blurring the lines and not doing and being cost effective. So it is a fine line, but as long as you read and understand and just follow the rules, you should be absolutely fine. And remember, you are in their home. So you are a guest with them. So you follow all of their rules.
Yeah. And I think, to add to that, knowing that, a SNF who's never done this before, they're looking to start a program like this, they're not going to be in it alone. No. It's almost like a tripod, if you will, partnership. In the instance where you and I are working together. So, we have our certain experts, you guys are experts in what you do. And so, we share a lot of information and really kind of work side by side, step by step with the facility to go through each step of the way and answer all those questions and have those resources available to them. But kind of looking at, what is next for your program? What do you see Carmen Health doing in this in-house dialysis world? Is there anything that you're really excited about looking in the future?
I'm wanting to help bring we are wanting to help and bring awareness to the AKI patient, to the acute kidney injury patient, the incidental patient. We want to make sure that we are receiving them with open arms and an open mind and the knowledge for kidney preservation. We want to have them come into the skilled nursing facility and do any kind of therapy sessions they might need with the extensive knowledge of their options, and with our clinicians on staff reviewing their labs ensuring that we're not over dialyzing. And because the Tableau is so gentle on that, on the three, the dialysate flow and the blood flows, it makes it really easy to do that. Ensuring that we are taking them off or not doing the 3 times a week or 5 times a week. Maybe they just need it once. And they obtain kidney preservation, and then we can move them on to maintaining that. Or home dialysis. Our goal is to ensure that people, the community, know that they have a choice, that life doesn't end when they're diagnosed with ESRD or any kind of kidney damage or anything that is needing extra treatment. That's why we only have a 5-chair clinic, because we don't want dialysis patients. We want to help them live their best life.
That's awesome. Yeah, I really love to hear you guys talk about that. Yeah, go ahead, Erin.
Well, our current footprint is we have 2 San Antonio area locations and then Brownsville, and soon hoping to grow outside of those areas and hopefully outside of Texas to provide this kind of service to even more patients who could benefit from this. And as Molly said, bringing patients home through this program. We know that a home dialysis option can truly help patients live a more flexible, happier, healthier, longer life, and that's our goal. And so trying to utilize this program also to bring patients into the home setting is part of our dream.
Nice. Well, and I'll just add one more thing. I know something Molly had mentioned to me that I thought was particularly interesting is you guys are dabbling in some virtual reality stuff, I hear, with maybe some of these dialysis SNF patients. Can you tell me a little bit more about that?
So virtual reality, I think, is absolutely amazing. Now, don't get me wrong. When I first heard this, my brain went like, okay, infection control, keeping their arm down. Are they alive behind the glasses? So many questions came to mind. But the reality is that I did my first trial and I did not leave my patient's side on the first trial. He was a patient who didn't like to finish his treatment. KT overVs were in the tank. And I was just like, hey, you know what? Do you want to go to Paris with me? And he was like, yeah, sure. Okay. So I pop these bad boys on him and I take him to Paris, not what he was expecting. And he finished out his treatment and his KT overVs came back stable. And every once in a while, we'll put him back on him. And it works. It works because, patients they get bored. You're sitting there. We do our best for their chairs. We do their best to talk with them. But if they're not listening to the staff, then they really don't have anything much to do other than watching TV. So we brought something new, and especially to the population. Like my grandmother's not going to know anything about VR, but if I put it on her, it might be a little fun for her, and it was. So
nice. That's so neat. Well, thank you guys for answering some of these questions. Don't go anywhere just yet. I think we have a few more, but we are going to throw another poll question out to the audience. So how ready is your facility to explore an in-house dialysis program? Maybe after listening to some of the conversation today, or maybe this is something that you already had on your radar. So you see a few selections there. Are you ready now? Are you actively looking at solutions, maybe like Tableau? Interested in soon, maybe in the next year or so? Maybe you need a little more information before, making any decisions, or are there some significant barriers to doing that? Or maybe you already have an in-house dialysis solution and are just looking to optimize your current program. So pick the answer choice that most corresponds to you. I also really quick want to mention, if you like the conversation today, if you want to hear more, you have more questions, Outset Medical is going to be at the Rethink Conference, August 18th through 20th in Chicago. If you would like to come visit us, we will have a booth there that we will be at throughout the entire event. And our audience today can actually pre-schedule a one-on-one conversation with our team by clicking on the Rethink image at the bottom left corner of your screen. So if you would like to do that, we would love to connect with you there. And take a look at our poll today. So we've got some people considering. We've got a few that already have dialysis, so that's awesome. But yeah, it's definitely. So those of you that are looking for more information, if you plan on being in Chicago, come join us at the Rethink Conference. We would love to see you there. But with that, I'm going to turn it back over to Zahida, and I think we have some Q&A.
Thank you so much, Jennifer, and thank you for that very insightful presentation. I can see that some questions have already been submitted, so let's dive right into that Q&A portion. As a reminder, if you haven't had a chance to submit your questions, please do so now using the Ask Question tool. We'd also love to hear your feedback on today's webinar, and so if you'd like to take a moment to complete the brief survey located at the top of your screens, we'd greatly appreciate your input there. So with that, I am going to jump into the audience questions. And here is, let me see, there's so many coming in, which is really great to see. Could this be implemented on all long-term care sites, not just SNFs, is the audience question.
Yes, it can be implemented on all long-term care sites as long as that's considered the patient's home. That's the key. It needs to be considered the patient's home.
I see. And then, let me see. All right. Let me jump to another one. So will you have to get certified to operate this machine? In Mississippi, the audience member wants to know they have to be certified to work in a dialysis center and have had to get continuing hours of training to maintain that on their nurse license. Speaking for LPN, she's asking.
Well, from a Texas reg point, you have to have 1 year of dialysis experience, well, 1 year of nursing experience. And of that 1 year of nursing experience, 6 months has to be dialysis. And then you have to have continuing education. For the floor staff, it's a continuing education. If I'm not mistaken, it's like 12 hours. For administrative, it's much more. I think it's 48 hours per year, if I'm not mistaken.
Mm-hmm. And then another audience member question here. Once Carmen Health system is in the SNF, what kind of reimbursement does the SNF get?
The reimbursement for the SNF, they get whatever they would usually get if they were to obtain the patient. They don't obtain the dialysis because the acuity, it doesn't change. They're just going to get the actual referral and the patient. We go ahead and we submit via their insurance on a home basis. So we get reimbursed the home fee. Now the SNF does reimburse us a little bit extra because it's like a referral, because they have our services in center. They are able to obtain that patient that a normal SNF would not be able to obtain. So that gives them leverage. So they do pay us an extra fee that they are very comfortable with.
Got it. And then will Carmen Health bring in their own people to the SNF to implement in-home dialysis?
Yes, we do bring in our own people. All of our people are trained on dialysis. All of our people are credentialed. The floor staff with the SNF never has to worry about coming in and treating a patient. We're fully responsible for it.
And then when implementing in-house dialysis, what is the biggest barrier you've seen? Staffing, space, or something else?
The biggest barrier, you know what, honestly, the biggest barrier I've seen is, I would like to say, physicians until they're educated. Once the physicians are educated on their reimbursements, on what it actually entails, they're very pleased with it. And it's not until the first and second month that it's like, oh, okay, now I feel comfortable.
Hmm. And then what role has in-house dialysis played in increasing census or improving case mix for higher acuity patients?
Oh, we went from 3 patients at Heritage in their facility to, after they saw what we were doing for these patients, to 15 in a matter of 3 weeks.
Mm-hmm. And then how has Tableau helped with administrative needs like documentation and reporting?
Tableau has an interface where it documents and it keeps record of all the treatments. So all of our staff has, and including Erin and I, we can real time see anything that's going on in the clinic. So it's a printout, we can upload it. If we miss a blood pressure, we can refer back to it. There's many things. I mean, it's a wonderful tool.
Mm-hmm.
Thinking from the biomed perspective on that, also when maintenance is done or anything to do with the machine is done, it's calculated there in the Tableau hub, and it's also in a form. So it's documented there, and it makes maintaining the machine and any of those sorts of documentation easy for us to pull up because the machine records everything.
Mm-hmm. And then could you leverage this product in-house at your facility, or is this product only certified as an at-home service?
Well, you could leverage it inside of an in-center. We were actually talking about that. Erin, I think, was wanting our next facility to go Tableau. She's mentioned that a couple of times.
Mm-hmm.
Yeah, and doctors tend to be a little hesitant with Tableau sometimes because the dialysate flow rate doesn't go up to 1 million miles an hour or 800 or 600. But really, if you look at the research, it doesn't have to go up that high to be able to clean a patient. It can have something to do with the contact time between the dialysate and the blood and the dialyzer, and so you may not want it running that fast. I've seen Tableaus in centers, in transitional care units, and they work. And one of the coolest things that I think I saw was when we started using Tableau in our SNF facilities, Molly came back and said, hey, our KT reviews are so good for these patients, and she was kind of worried about it in the beginning, and the patients' KT reviews have been really good. So it was neat to see the real life example.
Mm-hmm. An audience member wants to know this clarification. I think, I think that's been addressed. How does working with Outset differ from working with DaVita?
So DaVita is actually a dialysis company, more like we are Carmen. Outset is the machine company. And so DaVita could use Outset machines in whatever setting that they wanted to use. Jennifer, I don't know if you want to speak to this or not, but DaVita, when we went into some of the SNFs, had been in-house in some places, and it was just a different machine that they were using. So Outset is just a different machine. And it's all combined in one. You don't have a separate RO and a separate dialysis machine. It's the dialysis machine and then the RO on the bottom. It kind of looks like one of those mini fridges.
And here's another question. Does Carmen bill the health plan for their services?
Yes, we do. We do bill the insurance.
Mm-hmm.
And we bill them at a home rate.
Sorry, go ahead.
We bill them at a home rate.
Okay. Well, if there aren't any last thoughts, those are all the questions we have. I would, before we conclude, we encourage you to share your feedback by completing a brief survey. As I had mentioned earlier, your feedback is greatly appreciated and will help us improve future events and provide more valuable content. And as a reminder, this webinar recording will be emailed to you once available and located on the Skilled Nursing News website. And I'd like to thank our wonderful panelists again, and to our sponsor, Outset, and for each of you for attending this session. We hope to see you again at future events. Thank you so much.
Thank you.